General Hospital, General Hospital. This is Medic 5, currently inbound to your facility, ETA of about 10 minutes.
Hi, it's the nursing professor. Today I want to talk about disasters and mass casualty events because we're experiencing them more and more every day. So when we're talking about that, we're talking about things like mass shootings that happen on college campuses, in workplace. We're talking about natural events like hurricanes and tornadoes and the damage that they leave behind. We're talking about trains that actually jump a track or airplane accidents that happen. And with all of those, you have these mass casualties. And so you're responsible to be a part of that first responder team. And it's so essential that you understand what needs to be done. Otherwise, you're going to be so overwhelmed because trust me, you're going to be overwhelmed even if you know what next steps there are. Now, recently, of course, we had COVID where, at least in Washington, D.C., literally people were dying on the streets. New York was the same thing. And so it was something that even after having years and years of experience that I honestly had never dreamt that I would be involved in it. So really take this serious. Yearly, when they give you your competency on disaster preparedness, then really participate and listen and figure out where your command center is and all those things. So this is an activity that we're going to do today, and that I'm going to give you a short scenario. I'm going to give you 4 patients, and I want you to prioritize them in a way of who should be treated first. Okay. All right. So this is the disaster. Subway train is moving during rush hour. So it's full of people. It jumps a track and there's multiple injuries that happen. This particular subway is about a half a mile from the facility in which you're working. All right. So these are the 4 patients that you will encounter because you've been assigned to be the triage nurse. So the first patient is a 90-year-old who you meet on the floor crying out in pain with an obvious hip fracture. You can clearly see that that hip is displaced. So I want you to prioritize who needs to be seen first. So you have her, you have a second person who is a 35-year-old who's up and walking. She's complaining of pain in her arm. Again, her arm visibly looks like it's broken. All right. The third patient is an older gentleman who is on the floor. He's unresponsive, but he does have respirations after his airway has been repositioned. All right. So when you first come up on him, no breathing. You open up the airway, he starts to breathe. Okay. And your last patient is a 25-year-old with extensive bruising on her flank and chest, and she complains of severe pain. Her vital signs are all off. Her respiratory rate is under 30. Her radial pulse is present. It's at 90. And her blood pressure is 90/60. She is able to follow commands. So out of those 4, I want you to put a number as to the priority in which those patients need to be seen. And so you do that. I'm going to give you 30 seconds to do that. And when you come back to the next screen, it's going to have them listed in the priority and give you the rationalization for that. So I hope this really helps, and I'll see you next video. And please like and share this because it's a really, really important skill that we really need to be prepared to put into action at any given time. We don't know what the next hour will bring when you're actually a nurse in the hospital. So bye for now.